Imagine sitting at home and, without warning, your arm feels heavy, your words won't come out right, and something deep inside tells you this isn't normal. You're not in pain, so you hesitate, you think about waiting. But what if those next 3 minutes decide whether you walk, talk, or live independently again? Today, I'm sharing what seniors must do immediately before help arrives, because knowing these simple actions could protect your brain, save your life, and help you stay in control when every second matters. Many seniors ignore sudden, unusual symptoms because they seem minor, painless, or confusing at first. But this hesitation can be one of the most dangerous mistakes when it comes to stroke. A stroke rarely announces itself in a dramatic way. It often begins quietly, with subtle changes that are easy to brush off as tiredness, stress, or simply one of those days. An arm may feel weak or heavy, words may come out slower than usual, clock vision may blur slightly, or there may be an odd sense that something just isn't right. Because these sensations don't always cause pain, many people convince themselves that waiting is the sensible choice, when in reality, every passing minute can increase the damage happening inside the brain. Sudden symptoms are the body's emergency signal. When weakness appears on one side of the body, when speech becomes slurred or difficult, when confusion sets in without warning, or when balance and coordination suddenly fail, these are not normal signs of aging. They are signals that blood flow in the brain may be compromised. The brain depends on a constant supply of oxygen and nutrients, and when that supply is interrupted, brain cells begin to suffer almost immediately. Ignoring these early signs allows that damage to continue unchecked, which can turn a manageable situation into a life-altering one. Many seniors hesitate because they don't want to overreact or cause alarm. Some worry about being embarrassed if it turns out to be nothing. Others don't want to burden family members or emergency services. This mindset, while understandable, can be extremely harmful. Acting quickly is not overreacting, and it is never a waste of time to get symptoms checked when a stroke is possible. Medical professionals would always prefer to rule out a stroke than arrive too late to prevent serious injury. Another reason symptoms are ignored is because they can come and go. A person may feel weak for a few minutes, then seem to improve, leading them to believe the danger has passed. In reality, this can be a warning sign of an even more serious stroke ahead. Temporary improvement does not mean the risk is gone. It often means the body is struggling and needs immediate medical attention to prevent further damage. Recognizing and respecting sudden symptoms is an act of self-care and self-respect. It means valuing your independence, your ability to communicate, and your quality of life. The faster a stroke is recognized, the sooner treatment can begin, and early treatment dramatically improves outcomes. Quick action can reduce the severity of disability, shorten recovery time, and in some cases, save a life altogether. Ignoring symptoms takes away these opportunities, while responding immediately keeps hope and options alive. Calling emergency services immediately at the first sign of a stroke is one of the most critical decisions a person can make, yet it is also one of the most commonly delayed actions. Many seniors pause, hoping the symptoms will pass, or they choose to call a family member or neighbor instead. While this may feel comforting, it wastes valuable time and can significantly worsen the outcome. A stroke is a medical emergency that requires rapid, professional intervention, and emergency responders are trained to begin life-saving care the moment they arrive. Driving yourself to the hospital or asking someone else to do so can be dangerous during a stroke. Symptoms such as dizziness, weakness, confusion, or vision problems can worsen suddenly, increasing the risk of accidents or falls. Emergency medical services provide a safe, controlled environment where your condition can be monitored continuously. They can manage breathing, blood pressure, and other vital signs, and they can communicate directly with the hospital to ensure that the medical team is prepared before you even arrive. Time is one of the most powerful factors in stroke treatment. Certain medications and procedures are only effective within a narrow time window after symptoms begin. By calling emergency services right away, you increase the chances of arriving at the hospital early enough to receive these treatments. Waiting, even for a short period, can mean the difference between a mild stroke with good recovery and a severe stroke with long-term disability. Every minute that passes without treatment allows more brain cells to be damaged or lost. Some seniors worry about the cost or fear that they might be making a fuss. These concerns often lead to dangerous delays. Emergency responders are there to help, not to judge, and the cost of delayed treatment can be far greater in terms of health, independence, and quality of life. Calling emergency services is a responsible choice, not an inconvenience to anyone. It shows awareness and respect for the seriousness of the situation. When you call emergency services, it is important to describe symptoms clearly and honestly. Do not minimize what you are feeling or try to sound strong. Clear information helps responders assess the situation quickly and accurately. They may give you instructions over the phone, such as sitting or lying down safely, unlocking your door, or staying calm until help arrives. Following these instructions can improve safety and prevent complications. Immediate action also helps caregivers and family members. When emergency services are called first, loved ones can focus on providing emotional support rather than scrambling to make decisions under pressure. This organized response reduces chaos and fear during an already stressful moment. Calling for help right away sets the entire chain of care in motion, ensuring that every step taken afterward is faster, safer, and more effective, giving the best possible chance for survival and recovery while waiting for emergency help to arrive. What you do in those minutes can play an important role in reducing risk and preventing additional complications. After calling for help, the priority is safety and stability. Sitting or lying down right away helps prevent falls, which are a serious danger during a stroke due to sudden weakness, dizziness, or loss of balance. Trying to move around, walk, or complete tasks can increase the chance of injury and place extra stress on the body at a time when it is already under strain. Choosing the right position matters. If possible, lying on your side with your head slightly elevated can help keep the airway clear and reduce the risk of choking, especially if nausea or vomiting occurs. If lying down is not comfortable, sitting upright with good support is also acceptable. The key is to remain still and supported, avoiding sudden movements that could worsen symptoms or lead to a fall. Tight clothing around the neck or chest should be loosened to allow easier breathing and comfort. Staying calm during these moments is just as important as physical positioning. Fear and panic can cause blood pressure and heart rate to rise, which may increase strain on the brain. Slow, steady breathing helps signal the nervous system to relax. Gently inhaling through the nose and exhaling through the mouth can reduce anxiety and help maintain a more stable physical state. Even a few calm breaths can make a noticeable difference in how the body responds to stress. It is also very important not to eat or drink while waiting for help. Swallowing can become impaired during a stroke, even if it doesn't feel obvious at first. Food, water, or pills can easily go down the wrong way and cause choking or aspiration, leading to serious breathing problems. This includes medications that are normally taken daily. Unless a medical professional specifically instructs otherwise, it is safer to avoid all food, drinks, and pills until you are evaluated by professionals. Another common mistake is taking aspirin or other medications without medical guidance. While aspirin is helpful for some heart-related issues, it can be dangerous in certain types of stroke, particularly those involving bleeding in the brain. Taking medication without knowing the type of stroke can worsen the situation. Waiting for trained medical assessment ensures that treatment is appropriate and safe. If someone is with you, their role is to stay present, reassuring, and observant. They should monitor breathing, note any changes in symptoms, and be ready to share information with emergency responders. Keeping the environment quiet and calm can also help reduce stress. These simple actions, combined with stillness and calm breathing, help protect the body and brain until professional care arrives, creating the safest possible conditions during a critical window of time. Staying calm and conserving energy during the first moments of a suspected stroke can have a meaningful impact on what happens next. When the brain is under threat, the body often responds with fear, rapid breathing, and tension. This stress response can raise blood pressure and heart rate, which may place additional strain on already vulnerable brain tissue. By intentionally slowing down, both mentally and physically, you help create a more stable internal environment while waiting for professional care to arrive. Conserving energy is important because the brain is working harder than usual during a stroke. Trying to talk excessively, forcing movement, or repeatedly testing your strength can drain valuable energy reserves. Even simple actions like standing up, pacing, or attempting to shake it off can increase fatigue and worsen symptoms. Remaining still allows the body to focus its limited resources on maintaining essential functions such as breathing and circulation. Resting quietly is not giving up. it is a protective response. Calm breathing plays a powerful role in this process. Slow, controlled breaths help regulate oxygen levels and reduce the stress signals sent from the body to the brain. Shallow, rapid breathing often accompanies panic and can make dizziness and confusion worse. By breathing slowly and evenly, you support more efficient oxygen delivery and help reduce the feeling of overwhelming fear that can arise during an emergency. This calm state can also make it easier to follow instructions from emergency responders when they arrive or when they are speaking to you on the phone. Keeping the airway clear is another crucial aspect of this early response. During a stroke, muscle control can weaken suddenly, including the muscles involved in swallowing. Lying on your side or keeping your head slightly elevated helps ensure that saliva or vomit does not block the airway. This simple positioning step can prevent serious breathing complications. If someone is assisting you, they should remain attentive to your breathing pattern and be ready to adjust your position gently if needed. Mental focus also matters in these moments. Rather than letting fear take over, focusing on slow breathing or listening to a calm voice can help anchor your attention. This mental steadiness reduces unnecessary movement and supports cooperation with those helping you. For caregivers, offering reassurance in a calm tone can make a significant difference. Panic in the environment often amplifies panic in the person experiencing symptoms. All of these actions work together to reduce the risk of additional complications before medical help arrives. Staying calm, limiting movement, breathing steadily, and protecting the airway do not treat the stroke itself, but they help prevent secondary problems that could worsen outcomes. These steps buy precious time, preserve strength, and support the body during one of its most vulnerable moments, allowing emergency professionals to take over care under the safest possible conditions. Preparation and awareness give seniors and caregivers a sense of control in situations that might otherwise feel overwhelming. When people know what to look for and what actions to take, fear is replaced with confidence, and hesitation is replaced with swift, purposeful movement. Stroke situations are often chaotic not because they are complex, but because they are unexpected. Being mentally prepared turns those first moments into a clear sequence of steps rather than a rush of panic and confusion. Awareness begins with understanding that strokes are common and can happen to anyone, especially as we age. Knowing the typical warning signs makes it easier to recognize when something is truly wrong. This awareness should be reinforced regularly, not just learned once and forgotten. Repetition helps the brain respond automatically under stress, which is exactly what is needed in an emergency. Seniors who are familiar with these signs are more likely to take them seriously, and caregivers who recognize them early are more likely to act without delay. Preparation also includes practical habits that make a real difference. Keeping a phone charged and within reach at all times ensures that help can be called immediately. Saving emergency contacts and knowing how to unlock the phone quickly removes unnecessary barriers during a crisis. For seniors who live alone, medical alert systems or wearable emergency buttons can provide an added layer of security. These tools are not symbols of weakness, but of foresight and self-care. Caregivers benefit from preparation just as much as seniors do. When a plan is in place, caregivers are less likely to panic and more likely to focus on supportive actions. Knowing to keep the person still, calm, and safe while waiting for help prevents well-intentioned mistakes. Preparation also includes understanding what not to do, such as offering food, drinks, or unapproved medication. This knowledge helps protect the person experiencing symptoms and reduces the risk of complications. Sharing information is another powerful part of preparedness. Talking openly with family members about what to do in an emergency creates a shared understanding and responsibility. When everyone is on the same page, responses are faster and more coordinated. These conversations may feel uncomfortable at first, but they build trust and reassurance over time. Ultimately, preparation and awareness empower people to act decisively when every minute matters. They transform uncertainty into clarity and fear into action. By taking simple steps ahead of time and staying informed, seniors and caregivers greatly improve the chances of better outcomes, faster treatment, and stronger recovery, making preparation one of the most valuable tools in protecting health and independence.